We hope that you've had a great spring break. Another 7 weeks or so, we'll be getting into summer break. Can you believe it? Before you start making all those fun outdoor plans, beach vacations, days at the pool, on the lake, there's something we do want you to remember. Dr. Robert Skaggs is a dermatologist at the Kentucky Skin Care Center and Skin Cancer Center, excuse me. I see a lot of sunscreen here on the table. Let's talk about the best defense as we're out in the summer sun. Is it the sunscreen?
So actually the best defense is physical protection, so protective clothing. So I tell my patients I like a big hat. So not a baseball cap, because that doesn't protect your ears, doesn't protect the side of your face. So I like the ones with the 4-inch brim all the way around. That's the best. Sunglasses are actually very important as well. They protect your eyelids, which are places where skin cancer often pops up. And then, you know, sun shirts have really come a long way. Now they're fashionable, they're cool. And a lot of fishermen in the area that I have as patients, they use them. It's good to use at the beach as well. After you use that, you have to cover other areas, and I like to use sunscreen. This is a really great one for kiddos. So this is a stick, and you can kind of wipe it on. I have 2 little boys, and I like to use it as face paint. So especially for spring break and summer,
fun. Yeah, on their war paint.
It makes it fun for them. And then for the places you can't reach, they have lots of sprays. So sprays are great for your back and reapplying when you're out in the sun. So, yeah.
So you said, like, wear that big wide brim hat because a baseball cap or something's not going to cover the ears. I bet people forget to put sunscreen on their ears.
They do. And I'm a skin cancer surgeon, and I see lots of patients that have skin cancer on their ears. That's one of the most common places to get it. And your baseball cap doesn't cover that.
Right. What other areas of the body do you see skin cancer? People are just forgetting to apply sunscreen or to cover that area.
Right. So the most common place is actually the nose, and then it's the ear, and then other parts of the head and neck. Those are the most common areas.
Yeah. And you see this among, I mentioned you going to the beach or the pool, but I bet farmers are out in the sun. You know, a lot of occupations, people just have to be outside.
That's right. And you know, we used to not know much about sun protection or skin cancer, so I have a lot of patients that are farmers or construction workers, and those patients are getting a lot, you know, wearing long sleeve shirts really helps with those patients with jobs where you have to be outside.
So I know some people, they want to be bronzed, right? We think it looks attractive. I spent many years going to the tanning bed, which I regret so much now. Is there a way to tan safely?
So there's no safe tan, whether it's at the beach, in the tanning bed, especially not the tanning bed.
I know,
but spray tan is a great option. That's a safe chemical you can put on your skin, and you can look tan for your prom or your wedding or whatever you want to look dark for. But I think that your skin looks great.
Pale is in now, right? We're embracing the pale. We're going with it. Right? Okay, I get the slow clap from Chris Allen, so his approval over there. So let's talk, though, about who might be a candidate for skin cancer. I feel like I'm a prime candidate because I am so fair-skinned, and I had spent a lot of years in the sun and tan in bed.
So anyone can have skin cancer, and actually, young ladies that are from 25 to 29, the most common cancer diagnosis is actually melanoma.
Oh, and they're so young.
That's right, and it happens in sun-exposed and non-sun-exposed areas. So we have to check. I recommend to everyone to get skin cancer check at least once a year.
Melanoma, I mean, that's deadly. That's scary.
Melanoma is the worst skin cancer, so that's the most deadly of all the skin cancers. Those are the ones that we're most serious about checking at the skin cancer, but we check for any skin cancer at the Skin Cancer Center.
What do we need to be looking for at home?
Any spot that's not getting better, so spots that are not healing. I have a lot of patients that say, oh, I had a spot that looked like a pimple, but it just wouldn't go away. I couldn't cover it with my makeup anymore. And so those are the spots that are the most worrisome, or spots that just don't go away, that you know shouldn't be there.
Yeah, and so those yearly skin cancer checks can really potentially save someone's life, right? Because you might see something hasn't been a concern to that person, but it is to you.
Absolutely. Every day at the Kentucky Skin Cancer Center, I diagnose people with spots that they never knew that they had. They come in for a rash, or they come in for acne, and we diagnose skin cancer on those patients on a daily basis.
Right. It's not necessarily like a dark mole either. It can be, like you said, it can be like something you just think is a pimple that's not going away.
That's right. So skin cancer most often with melanoma, it's a brown or black spot. But melanoma can also be pink, it can be red, it can be white, and then the other skin cancers can be any color as well.
All right. Well, thank you. Awesome information. I hope you'll come back because we could talk about this a lot more. But something else that's interesting is you have this shot glass of sunblock, and you said this is really how much you need to be slathering on, right?
So the average person needs a shot glass full, that's 1 ounce of sunblock to put on their whole body.
All right.
So, and about 80% of folks don't do that.
Right. So make sure you're putting on enough to really protect your skin. Thank you, Dr. Skaggs. And he has opened the Kentucky Skin Cancer Center. That's on Wallace Court in Bowling Green. You can reach them at 842-1999. You can also go online to their website.